So here's my blank sheet. Blank. Everything's blank. Okay. I'm gonna walk into the patient's room. Knock, knock. Hi, my name's Maddie. I'm gonna be your student nurse today. How are you doing?
Doing good. How are you?
I'm doing good. I'm here to do a head-to-toe assessment on you. Is that all right?
Yep.
Can you please give me your name and date of birth, please?
Drew Berry, 5/29/02,
And where are we? What city are we in right now?
Midland, Michigan,
And what year is it?
2020.
Okay, so the patient is A&O times 3 because he is alert and oriented. Okay, the next part of the head-to-toe exam is a health history. So I'm going to ask you some questions. Some of them are a little personal, so I apologize for that. And then we're going to ask you a series of questions about your medical history. So the first question is, how often do you smoke?
None.
How often do you do drugs?
None.
How often do you drink alcohol?
None.
How often do you engage in sexual activity?
None.
Okay, thank you. Do you have any past medical diagnosis?
Mm-mm.
No?
No.
Okay, are you on any daily medications?
Claritin.
And that is just for allergies?
Yeah, just allergies.
Okay, are you on any herbal or supplements, or herbal medications or supplements?
No.
No vitamins?
No.
Okay, the next portion is a pain assessment. From 0 to 10 on a numerical scale, 0 being no pain and 10 being the worst pain you've ever felt, what would you rate your pain?
0.
0, okay. The next aspect is, can I inspect your hands, please? Okay, there's no redness or swelling, no lesions, anything on the hands. There's no clubbing in the nails. The nails look normal. And the capillary refill is good. It is less than 2 seconds. So while I have you here, I'm going to take a set of vitals. I normally would take the patient's blood pressure and temperature and SpO2, but I don't have the equipment for that at home. So I'm going to take his pulse for a full minute. Okay, that is a full minute. Got to do the math. The pulse was 62 and the respiratory rate was 14. The next thing I'm going to do is inspect your arms. So can you hold them out for me? The temperature is equal throughout the arm. Skin looks normal. There's no redness, swelling, edema, no lesions. Skin is a normal color. The muscle tone is symmetrical. Everything is symmetrical on the arms. I'm going to palpate the radial pulse on each arm for symmetry and the brachial pulse on each arm for symmetry. The radial pulse is normal and equal on both sides. The brachial pulse is also equal for both arms. So the next thing I'm going to do is, can you squeeze my fingers, please, for testing your strength? Good. Okay, don't let me push in. Don't let me push out. Don't let me push up. Down. Okay, good. Everything is normal for that. Okay, so this one is going to test your spinal accessory nerve. So I'm going to have you shrug your shoulders up. Normal, that is normal. So while I'm up here, I'm going to look at your tissue turgor. It is good. There was no tenting, so that is a good sign that the patient is hydrated correctly. The next portion is the head. So I'm going to look at the patient's, he had a hat on earlier, but now he doesn't. I'm going to look at his scalp, palpate his scalp, and inspect his hair. So how often do you wash your hair?
Every day.
Every day. Okay, so when I touch around your head, do you feel any tenderness or pain?
No.
Okay. Everything on the hair looks normal. The scalp feels normal. He says there's no pain. So we're going to continue on with the face. So the first thing I'm going to do is I'm going to test your facial nerve. So can you smile for me? Okay. Can you make a frowny face? Okay, angry face. And puff your cheeks out like a blowfish. When he does all this, that looks normal. Also, I forgot to note at the beginning when I started with his head that his face and head look symmetrical. Okay, so now with this fork, I'm going to touch, you're going to close your eyes and I'm going to touch an area, you can keep your eyes open right now. I'm going to touch an area on your face and you're going to say right cheek or forehead. So close your eyes. And that is testing his facial nerve as well.
Left cheek.
Yeah.
Forehead. Chin.
Okay, and now we're going to do the same thing, but you can open your eyes. And this is with the trigeminal nerve, the sharp of the fork or the dull on his face, and then where it is located. So you can open up. This is sharp. This is dull. So if I did that, you would say dull right cheek. Okay?
Sharp forehead. Dull chin. Dull left cheek.
Okay, good. Okay, everything with that is normal. So the head portion of the assessment is now done. So we're going to move on to the eyes. So first I'm going to just observe or inspect his eyes, and I'm going to note that his sclera, can you please look down, please? Up. His sclera is white, and the corners of his eyes are pink, and they look moist, so that is a good sign that he's hydrated. The sclera are white. There's no sign of jaundice. The next part is the ocular motor cranial nerve. So with this cranial nerve, it's assessing the perla of the pupils so that they're equal, round, reactive to light, and that they accommodate. So I'm going to shine this light in your eye, and just keep looking straight ahead. Okay, good. So now with this, that looks normal in the direct pupil. So now with this one, I'm going to put a hand on the nose, and I'm going to shine it in one eye, and I'm going to observe the pupil constriction in the other. That is normal as well. They both constricted and they were reactive to the light. So the next part is the accommodation step. Okay, so you're going to look at this pen, and then when I tell you to look at the wall, you're going to look at the wall. Look at the wall. His pupils did accommodate, so that appears to be normal. The next part is going to test your ocular motor, trochlear, and abducens cranial nerves. So we're going to do this with the 6 cardinal fields of gaze. So just follow my pen. Okay, good. Everything looks normal with that. The next thing is you're going to do finger to my pen as I move it. Okay. This is testing the cerebellar function. And then can you do like with your hands, both of them? Okay, good. That looks normal. And then, flip the hands. Okay, good. Okay, so now that the eyes are done, we're going to do the mouth. So first, I'm going to inspect his lips. I'm going to note that they are symmetrical and they look normal. There's no abnormal findings. So the next test is for the hypoglossal cranial nerve. So can you stick your tongue out for me, please? Okay. The tongue is symmetrical and it looks normal. No abnormal findings there. The next one is, can you open up, please? I inspected his oral mucosa, the teeth, gums, uvula. They all were, well, the teeth were not pink, but the gums and the uvula and the hard palates, soft palates, they were pink and moist, so that appears to be normal. Can you open up and say wide? Okay, good. The uvula went up and it was symmetrical, so that test tested the glossopharyngeal and the vagus cranial nerves. The mouth is now done. Shoot. Okay, now I'm gonna do the ears. I'm gonna just inspect his ears, and I'm gonna touch his pinna, and I'm just gonna note that they're symmetrical on the side of his head and they're aligned correctly. Normally at this stage I would use an otoscope to inspect the tympanic membrane, but I don't have one of those right now, unfortunately. Next part is the neck. I'm gonna palpate the tracheal alignment to make sure there's no deviations. It's all centered right down the middle. I'm gonna listen to your carotid, each one separately, to look for equal and symmetry. They are equal on both sides. So the next part is listening to the carotid arteries. And so when I'm gonna listen with the bell because I'm listening for bruits. I'm gonna flip that over. So when I listen to the one side, you can't breathe, so I don't mistake the sounds. Okay. Again, they both sound normal, and there's no whooshing or any signs of a bruit in there. Now I'm gonna palpate or attempt to palpate all the lymph nodes. So the occipital is at the back of his head. Then I'm feeling his post-auricular behind his ear, pre-auricular. Then we got the submandibular, submental, and then can you push your shoulders forward so I can feel your clavicle? Supraclavicular. Then I'm going to feel your cervical chain. Again, those were not palpable, which is a normal finding unless the patient is sick or has an infection. Okay, now I'm going to take this opportunity to look at my sheet to make sure I didn't miss anything. Okay, I did miss. Okay, this is for, can you do the range of motion with your shoulders, swimming motions? Just checking for that. And then flex and extending of your elbows. Okay, and then for the nose, I'm going to have you close your eyes. And then I'm going to put this scent in front of you and you have to tell me what it is.
Cinnamon.
Okay, good. Okay, those were the only two things that I missed there, so I'm going to proceed. Okay, so I'm going to have you flip to the side so I can get behind you. So first, I'm going to palpate his thyroid. Can you swallow for me? Okay, everything is normal there. Can I pull up your shirt to here? Is that okay?
Yep.
Okay. First thing I'm going to do is inspect the skin of his back. It is the correct color. There's no lesions. I see freckles, but there's nothing that would concern me there. I'm going to measure his chest wall expansion, so can you take a deep breath for me? Each lung expanded equally, and there's no abnormal findings there. So now I'm going to percuss in six positions on each side, so for a total of 12 spots on his lungs. Everything sounded normal here with the percussion. Now I'm going to auscultate for his lung sounds. Again, that is in the 6 spots with 12 total. So when I say take a deep breath, just breathe, please.
All right.
Breathe. 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 Are you doing okay? Do you need to take a break?
No, I'm good.
Okay. 6 more. Breathe. 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 1 more. Breathe. Breathe. Okay, that's good. Everything with that sounded normal. His lungs expanded equally on both sides. Nothing there would concern me. Okay, I'm going to pull your shirt down. Okay, now you can lay flat on the bed. No pillow, please. Just lay flat. Oh, shoot. Okay, so for this portion, sorry, too tall. Okay, so the first thing I'm going to have him do is, can you turn towards the wall, please? I'm assessing for jugular vein distension, so looking for any bulges in his neck. He doesn't have any, so that is good. So the next thing that I'm going to do, Drew, is I'm going to listen to your heart sounds and inspect your chest. Is there any particular way that you would like me to do that?
However you want to do it.
Okay, so I'm going to pull your shirt down, and I'm going to inspect your chest. Everything looks normal. There's no freckles up here. Skin is the right color. There's no sign of cyanosis or anything like that. Everything looks good. So now I'm going to listen to his heart sounds, and I'm going to listen in 5 spots, and I'm going to listen with the diaphragm and the bell on each spot. So I'm going to go up. I'm in the second intercostal space on the right side of the sternum. So this is the aortic. Diaphragm sounds normal. Bell sounds normal. Now I'm on the left side of the sternum in the second intercostal space at the pulmonic. Diaphragm sounds normal. Bell sounds normal. Now I'm at the third intercostal space at the herbs. Diaphragm sounds good. Bell also sounds good. Now I'm in the fourth intercostal space at the tricuspid. Diaphragm is normal. Bell is also normal. I am now in the fifth intercostal space, mid-clavicular at the mitral valve. I'm going to listen to his heart rate for a full minute to determine his apical pulse. His apical pulse was 60, and I'm checking with the bell now for any signs of a bruit. Bell side was normal, so for all of his heart sounds were normal, and there was no sign of a bruit, so there was no whooshing noise when I used the bell. So now that is complete, I'll pull your shirt down. The next part is the abdominal assessment. So can I pull your shirt up?
Yeah.
So first, shoot, it's turning off. First, I'm gonna inspect the abdomen for symmetry or any lesions or lumps that I see. Everything looks good there. The next step is to auscultate. In the 4 quadrants, I'm going to start in the right lower quadrant and move in the direction of the large intestine. So I'm going to auscultate that. The bowel sounds in each quadrant was normal. I heard gurgling noises, and there were at least 5 noises before I moved to the other quadrant. So the next step is to auscultate the abdominal arteries. So first I'm going to start with the aortic. I'm with the bell now, sorry. I'm at the aortic. Sounds good. Right renal. Sounds good. Left renal. Right iliac. Left iliac. They all sound normal. There's no whooshing noises, so there are no bruits present. Okay? So now the next step is to percuss. So the same thing that I did on the lungs. I'm going to tap on my fingers and I'm going to listen. I'm just moving in the 4 quadrants again. Everything sounded normal there. Next, I'm going to do light palpation and then followed by deep palpation. So light first. I'm feeling for any masses at the top, or any lumps. And then with deep palpation, I'm feeling for any deep masses or any deep lumps. Everything feels good there. I'm now going to palpate the patient's femoral pulse and then check for symmetry on both sides. This one's difficult to find. I'm down the left side, moving to the right. The patient's femoral pulse is normal and they're equal on both sides. So next I'm going to auscultate the femoral pulse with the bell side to assess for any bruits. Femoral pulse, or the femoral artery sounds normal. There's no whooshing, so there's no sign of a bruit there. Okay, so now I'm going to take this time to check my sheet to make sure I didn't miss anything. Okay, I think I'm good. So Drew, if you could, I'm going to have you sit up and take off your shoes and your socks. During this time, I'm going to inspect his legs and his toes. So everything looks even here. Looks even. Temperatures equal throughout the leg. They're symmetrical. Temperature is again the same. I'm going to check for edema. There's no signs of edema when I push. There's no pitting edema there. I'm going to check the popliteal pulse on each leg to make sure that it is equal in both. Popliteal pulses are equal and symmetrical in both legs. Next thing, I'm going to check the posterior tibialis pulse for symmetry, which is behind the ankle bone. Those are also symmetrical. And then the last one that I'm going to check is the dorsalis pulse, which is at the top of the foot. Those are also even and symmetrical. Okay, Drew, I'm going to have you put on your socks and shoes again. Oh, before you stand up, I'm going to do sharpen dull on your feet.
No socks.
No, yes. Sharpen dull on his legs. So this is sharp. This is dull. I'm going to either do it on your knee or your shin or the bottom of your foot. So you just tell me if it's sharp or dull and then where it is located. Okay?
Yep.
Okay, close your eyes.
Sharp shin.
Yep.
Dull bottom foot. Sharp knee.
Okay, good. Now I apologize for that. You can put your socks back on. Okay, and while you're sitting there, stay sitting down. I'm gonna test this patellar reflex. I would have like the hammer thing, but I don't have that at home, so I'm gonna use the side of my hand. Okay, good. So now I'm gonna have you stand up, and we're gonna test the acoustic. We're going to test the acoustic cranial nerve, so that is with the Romberg test. So, Drew, I'm going to have you close your eyes for 20 seconds and just stand there. Close your eyes. And you're good to go. Okay, time. Again, that was for 20 seconds. He didn't sway or show any signs of swaying, so that is a negative Romberg, so he is good to walk. So the last thing I'm going to have you do is I'm going to have you do heel to toe walk, heel toe, and then do it back. Turn around, do it back. Okay, sit back down. He is good there. I just have a few more questions for you, Drew. So, how often would you say you exercise in a day?
Every day.
Or during the week?
Every day.
Every day? What would that consist of? Like cardio, weights?
Mostly cardio, some weights.
Okay. Would you say you eat fairly healthy, like fruits and vegetables and stuff like that?
Yep.
Okay, good. When you have a meal, do you eat all of it?
Yeah.
Okay. So I'd give my patient a Braden scale score of 23. He is mobile. He exercises frequently. He eats a nutritious diet, and he eats plenty of food. I'm going to take this time to look at my sheet to make sure I didn't miss anything. I think we're good to go. Good job.